Hey, how are you? Thanks for coming out. I'm a neurosurgeon, and I took time out of my schedule today to be here because I think it's very, very important. This is my issue. I'm a physician. I'm not a politician. I'm not speaking for any organization, but it's amazing how many physicians share my perspective. Every day I hear from people like you, my patients, telling me they're scared about what's going to happen with this bill and what it means. And I've heard from my colleagues across party lines that they're scared about what's going to happen. I paid attention during the election, and I paid attention to what the candidates were saying about health care. And the very first thing I said when we saw the Obama plan is, he can't pay for it. He can't do this. And when you saw the bill in action, the bill's a sham. The bill can't stand on its own, and it sells out the people it's supposed to be serving. They didn't get our perspective. They didn't ask the doctors. We're the ones on the sidelines who are going to be working under the system. They tried to buy off the American Medical Association, and the AMA initially said no, but guess what? They caved. They gave special deals to Louisiana, to Nebraska, to the unions. They're not giving us a deal. Here's what I think this bill is going to mean for us. We're going to lose our stewardship over health care. We're going to lose the sanctity of the relationship that we have with you all. You are going to lose some autonomy. You're going to lose your voice. And why do I say that? The deck is stacked against you when it comes to the rules. In my line of work, what I want to find informed, interactive patients. I want to empower the patients as much as possible. These bills don't do that. They empower the government. And as we've seen time and time again, the government can't do it. Medicare's bankrupt, and they want to expand the system. We don't like that system. Let me give you one other vantage point from the standpoint of a doctor. If I had $1 for every time I heard from one of my colleagues, if they pass this bill, I'm done. If they pass this bill, I'm done. I'm not going to deal with it. That's a scary sentiment when you realize that the population is getting older and the population is getting sicker. And when I look at my patients, if I told you the number of times this year that I had to do life-saving, cutting-edge interventions on people, and I said to them, you know, if you were in Great Britain, if you were in Canada, you wouldn't be getting this. Let me just tell you one other thing. They're trying to piggyback this bill on the legacy of Edward Kennedy. I can tell you for a fact, in any of the European countries, a 78-year-old man with a malignant brain tumor would not get Ted Kennedy care. Unless he was Ted Kennedy.
That's right. That's right.
So what's the important point here? If we're not going to have responsible reform, then we need to have an option to opt out. I will say one thing to you as a physician. A lot of my colleagues complain, nobody does anything about it. My patients are the ones doing something about it. You all are doing something about it. So what I would ask you today, to speak up on behalf of this thing that John's trying to put out, go to your physicians, go to your healthcare providers, tell them we support you. We support you. We don't want anything to ruin our relationship, and get behind this bill. Thank you.
Thank you.